Hello, this is Dr. Gay from First Look MRI, and this is a 22-year-old gentleman who was playing soccer and injured his left shoulder and clavicle area. He went to the doctor's office and they did an x-ray and they read it as normal, so they sent him home, but the pain persisted and he decided to get an MRI just to make totally sure they hadn't missed anything. And this is a view, a coronal view. We see the right lung, left lung. This is the chest wall and ribs. And here's the neck to get oriented. Here's the base of the left neck and left shoulder. And this is a marker over the area where he's having pain over the left clavicle. This is the midline. Here's the left chest. Here's the back, and here's the front to get oriented on this view. So this is called an axial view. This is called a coronal view. So we're going to look at his right clavicle over here where he's not having symptoms. Just look at that on this view. If we slide him across, we're going to see this area. This is the right clavicle. This is the outside where it goes to the shoulder. The AC joint is right here, and we're looking at the shaft coming across. We see the black line, which is the cortex. We see the white area here, and that's the marrow. And we're going to follow this across. We see the bone is continuous. There's no evidence of a fracture. Here's the sternoclavicular joint. So nice, normal right clavicle. Now we're going to look at the opposite side, left clavicle. And we see the outside. This is a clavicle coming across. Here's the mid shaft. And we say, wait a minute. Where's the continuity? So right here we have a fracture of the clavicle. And here's the other piece of it right here. It continues across here. So this gentleman has a marker over where he's having symptoms right there, that white dot. And he has a displaced fracture of the clavicle right there. This is an axial view. We're going to look at this in another plane. And I put some arrows right there where he has a fracture involving the mid shaft of the clavicle. Here's the clavicle coming across right there. Here's a fracture. Now one more view, we'll look at this. And on this view, we went down through the plane of the clavicle to see that a little bit better. And here it is. So this is a view where this is the outside, lateral side, this is the medial side. We see the shaft here. We see the displaced fracture. There's overriding by one shaft width. And I'm sorry, there's bone displacement rather by one shaft width. And a little bit of bone overriding. So you're going to have to see the orthopedic surgeon and have this pulled straight, get the alignment back. And you see all the gray signal all around this. This is edema and hemorrhage, tearing of the deep muscles, and some blood products surrounding that. So a fracture of the midshaft of the clavicle that did not show up on x-ray. And thank you very much.